Your swollen ankles are not a heart problem. Here is what nobody told you. Do this right now. Take off one sock, just one. Look at your calf where the elastic band sat all day. If you can see a groove pressed into the skin, a clear indentation that stays there for 30 seconds, a minute, sometimes 5 full minutes before the surface finally smooths out again, then I need you to keep watching. Because what you are looking at is not a sock problem. It is not a salt problem. And despite what the majority of people over 60 have been told by their doctors, in roughly 70% of cases, it is not a heart problem either. It is a drainage problem. And the organ responsible is the one nobody ever sat down and explained to you. Right now, as you watch this, fluid is already sitting in your lower legs, possibly half a liter, possibly a full liter, pulled quietly into the tissues around your ankle and calf while you were sitting today. And tonight, when you lie down to sleep, that accumulated fluid is going to do something to your body that disrupts your sleep, puts unnecessary stress on your heart, and accelerates every health challenge you are already trying to manage. I am Dr. John, and today I am going to show you exactly what is happening inside that swollen ankle, why the standard advice you have received has not worked, and the 5-minute bedtime habit that can drain that fluid before it ruins your night. Let me start with something you already know. You come home at the end of the day, you pull off your shoes, and there they are. Ankles that look noticeably thicker than they did this morning. Calves that feel tight and heavy, almost pressurized. Rings on your fingers that suddenly will not budge. You press your thumb into the skin just above your ankle bone and watch it leave a small white crater that takes far too long to fill back in. You stand up after an hour in the chair and your legs feel like they have been filled with wet sand. And when you bring this up at a doctor's appointment, what happens? You get asked about your heart. You get told to reduce your salt intake. You get handed a prescription for a diuretic, a water pill that sends you running to the bathroom every hour. And for some people, that helps a little. For most people over 60, it helps almost nothing because the water was never in your bloodstream to begin with. The water was in your tissues, and a diuretic cannot reach tissue fluid. It can only pull water out of the blood. So for years, you may have been treating the wrong compartment entirely. Let me fix that right now. Your body has 2 fluid drainage networks, not one. Most people only know about the first one. Blood. Arteries carry fresh oxygenated blood out from the heart. Veins return used blood back. That entire system has a dedicated pump, your heart. It runs continuously, automatically, every second of your life, whether you are moving or sitting completely still. The second network is called the lymphatic system. And here is what no one explained to you. It has no pump, none whatsoever. Lymph is a clear, pale yellow fluid that constantly seeps out of the tiny blood vessels in your tissues. It bathes your cells, picks up cellular waste, dead bacteria, excess protein, and excess water. Then it must be returned to the bloodstream through a completely separate set of vessels called lymph capillaries and lymph ducts. Your body moves approximately 2 liters of this fluid every single day. But those lymph vessels have nothing driving them. No heart, no automatic mechanism. They move only when you move. Think of your lymphatic system as a conveyor belt that operates only when you put weight on it. Every step you take, every contraction of your calf muscles, every flex of your ankle squeezes the lymph vessels and pushes the fluid upward toward the heart. The moment you stop moving, the belt stops running. Sit still for 3 hours and the fluid simply accumulates in your lower legs, pooling quietly, doing nothing. When you are 30 years old, this is a manageable inconvenience. Your lymph vessels are elastic. The one-way valves inside them are tight and function precisely. A single walk across the room can restart the entire system within minutes. After 60, 3 changes happen simultaneously. The lymph vessel walls stiffen, the valves begin to leak, and the connective tissue around your ankles, the loose matrix that holds everything in its proper place, loses its own elasticity. Fluid seeps out faster than before, and the system drains it more slowly than before. The math stops working. The reservoir grows, evening after evening. Before I go any further, I need to draw a clear and important line. There are situations where ankle swelling is not a lymph drainage issue. There are situations where it is a genuine medical emergency. Please stop and listen carefully. Go and see a doctor today if any of the following describe you. One leg suddenly swells dramatically more than the other within the space of a few hours, and it is painful, warm, and red to the touch. That pattern can indicate a deep vein blood clot. It is dangerous. Do not wait. Both legs are swelling and you are also having difficulty breathing, especially when you lie flat. You are waking up gasping in the night. You cannot climb a flight of stairs without stopping to catch your breath. That combination points to significant heart strain that has moved beyond the early stage. Swelling accompanied by sudden weight gain of 4 or 5 pounds within a single week and urine that appears foamy or cloudy. That pattern suggests the kidneys may be allowing protein to escape into the urine. That needs blood work within days, not weeks. Swelling on one side only, painless, firm to the touch, in someone with a history of cancer treatment in that region. That can indicate lymph node blockage that requires proper evaluation. If none of those descriptions apply to you, if your swelling is gradual, affects both legs equally, is worse by evening and noticeably better by morning, and you have no trouble breathing at rest, then what follows is specifically for you. Now, chronic lower leg swelling after 60 falls into essentially 3 distinct patterns. They look nearly identical to the naked eye but have completely different causes and require completely different approaches. Pattern 1 is venous. Your veins are struggling to return blood back to the heart. The one-way valves inside the veins have weakened or failed. Blood pools in the lower legs. Pressure inside the vessels rises. Water is forced out through the vessel walls into the surrounding tissue. People with this pattern usually have visible varicose veins, sometimes a brownish discoloration on the shin just above the ankle, and the swelling tends to be dramatically worse on days spent standing rather than sitting. Pattern 2 is lymphatic. This is the pattern we are addressing today. Lymph flow has slowed. The tissue is saturated. The swelling is soft, leaves a visible pit when you press it, and feels puffy rather than tight. It often involves the top of the foot, the area just behind the toes. In people who have had long-standing lymph congestion for years, the skin on the top of the foot becomes so thickened that you cannot pinch it between 2 fingers. That is a recognizable clinical sign pointing strongly toward lymph involvement rather than venous disease. Pattern 3 is cardiac or renal. The heart or kidneys are not managing fluid volume properly. The swelling is symmetrical, worsens progressively through the day, and is accompanied by other symptoms: shortness of breath, waking repeatedly to urinate through the night, extreme fatigue, or rapid unexplained weight gain. If those partners are present, pattern 3 is the likely cause, and it requires a proper medical workup, not a home protocol. The majority of people over 60 with chronic evening ankle swelling and no other accompanying symptoms fall into pattern 2. Lymphatic. Let me tell you about someone I will call Dorothy. She was 68 years old, a retired school teacher who had lived in the same house for 30 years. She walked into a clinic convinced her heart was beginning to fail. For 2 years, her ankles had been gradually thickening by evening. At first, the change was slight. Then it became significant enough that she could no longer wear the shoes she had worn for years. She bought wider shoes. The swelling continued to progress. She mentioned it at a routine checkup. An echocardiogram was ordered, an ultrasound examination of the heart. The heart looked entirely normal. Her ejection fraction, the percentage of blood the heart pumps out with each beat, was 62%, completely within normal range. But Dorothy was still swelling. She was prescribed a diuretic. She took it faithfully for 6 months. She was running to the bathroom constantly throughout the day. She felt exhausted and dehydrated. The ankle swelling barely changed. Then she said one thing that unlocked the entire picture. She said, "The strange thing is that when I travel and walk around all day, my ankles are actually better." That was the diagnostic clue. Her swelling improved with movement. Her swelling worsened with prolonged sitting. Her heart was functioning normally. Her kidneys were fine. Her veins on ultrasound showed only mild age-related changes. What Dorothy had was a lymphatic drainage problem that no diuretic could address because the fluid was not in her bloodstream where the medication could reach it. It was in her tissues. Here is what was happening to Dorothy's body every single day, and quite possibly yours. She wakes up in the morning. Her ankles look nearly normal. She has been lying flat for 8 hours. Gravity was not pulling fluid down into her legs. Her lymphatic system had all night to slowly clear the previous day's accumulation. By morning, she is almost back to baseline. She gets up, has breakfast, sits at the kitchen table for an hour, sits in the car for 20 minutes, sits at her volunteer desk for 3 hours, has lunch, sits again. By 2 in the afternoon, she has been upright but essentially immobile for 7 hours. Fluid has been steadily leaking from her capillaries into the tissues of her lower legs the entire time. Her calf muscles have barely contracted. The lymph conveyor belt has barely moved. The fluid has been accumulating quietly, a small amount at a time, into a reservoir she cannot see and cannot feel until evening. By dinner time, the groove appears where her sock elastic sat. By 9 in the evening, the ring on her finger is tight. By 10, she lies down. And now the real problem begins. All that accumulated fluid in her ankles, now that gravity is no longer pulling it downward, slowly begins to reabsorb back into her bloodstream. Her heart receives an unexpected additional volume of fluid. Her kidneys detect the increased load and shift into overdrive, producing urine to compensate. She wakes at 2 in the morning, then again at 4, then at 5. By 6, she is exhausted before her day has even begun, and the exact same cycle repeats the following day. Let me give you 2 quick self-tests right now. They take 30 seconds total. Test 1, the pit test. Find the bony ridge along the front of your shin, approximately 4 inches above your ankle. Press your thumb in firmly and hold it there for 15 full seconds. Lift your thumb and look at what remains. If there is a visible indentation that takes 10 seconds or longer to smooth back out, you have what clinicians call pitting edema. A slight dent that fades within 30 seconds is grade 1. A deeper dent lasting longer is grade 2. A deep dent that persists for over a minute is grade 3. Write down which grade you are at. You will retest in 2 weeks after following the protocol I am about to give you, and the change will be measurable. Test 2. The foot skin pinch. Try to pinch the skin on the top of your foot, just behind your second toe, between your thumb and forefinger. If you can easily lift the skin into a small fold, your lymph fluid is moving adequately. If you cannot lift the skin at all, if it feels almost fused to the structures beneath it, you have a more advanced degree of lymphatic saturation. That finding has a clinical name, a positive Stemmer sign. And it is one of the simplest indicators of chronic lymph congestion that exists. Now let us talk about what is making your lymph swelling worse. Most people over 60 are doing all 3 of these things daily without any awareness of their impact. The first is hidden sodium, not the salt shaker on your table. The hidden sodium embedded in the food supply. Aged cheese, cured and processed meats, canned soups and broths, commercially baked bread, condiments, restaurant meals, frozen and packaged convenience food. Sodium pulls water out of your bloodstream and drives it into your tissues. Your body retains approximately 4 cups of water for every gram of excess sodium consumed. Most Americans over 60 are consuming roughly twice the sodium they estimate they are eating because the majority of it is invisible in processed foods. The second is sitting after dinner. The hours between 7 and 10 in the evening, the hours when you finally sit down and rest in your chair after a long day, are the very hours when your lower legs accumulate the most fluid. 3 hours of near-complete immobility after your largest meal of the day creates the worst possible conditions for overnight fluid reabsorption. You are setting yourself up to be awake at 2 in the morning before you even get into bed. The third is evening alcohol. Even a single glass of wine in the evening dilates your capillaries, increases the rate at which fluid leaks from vessels into surrounding tissues, and suppresses the hormone your brain uses to signal your kidneys to slow their urine production during sleep. One drink and your ankles will be measurably worse by the following morning. Now in the other direction, the things that actively support lymph flow and fluid balance. Water. This one feels counterintuitive. Most people who are swelling instinctively drink less water, reasoning that more fluid will make the swelling worse. The opposite is actually true. Dehydration thickens lymph fluid, making it sluggish and difficult to move through the vessels. A properly hydrated body has thinner, more freely flowing lymph that the vessels can move efficiently. Aim for roughly half your body weight in ounces of water per day, spread throughout the day, and taper off meaningfully after 5 in the afternoon to avoid overnight bathroom trips. Foods rich in natural flavonoids. These are compounds that strengthen the walls of small blood vessels and reduce the rate at which fluid leaks into surrounding tissue. The best sources are dark berries, buckwheat, citrus peel, and red cabbage. A cup of mixed berries daily has measurable effects on capillary integrity over approximately 8 weeks of consistent intake. Protein. This one genuinely surprises people. Low blood protein, specifically low albumin, is one of the quiet and frequently overlooked drivers of tissue swelling in older adults. Albumin is the protein that physically holds water inside your blood vessels. When albumin levels are low, water leaks out into surrounding tissues and accumulates there. Many older adults are mildly protein deficient without any awareness of it. 2 servings of high-quality protein daily, eggs, fish, chicken, lentils, or cottage cheese directly improves the physical mechanics of fluid balance in the body. Magnesium. Deficient in the majority of people over 60. Magnesium is involved in smooth muscle tone throughout the body, including the muscle tissue in the walls of your lymph vessels. The easiest food sources are pumpkin seeds, dark leafy greens, and almonds. Getting adequate magnesium supports the structural function of the very vessels you are trying to activate. Now, the 5-minute bedtime habit that drains your ankles before you sleep. This is the core of everything I want to share with you today. Every single part of this sequence matters. Please pay close attention. In the morning, before your feet ever touch the floor, while you are still lying flat in bed, do 30 ankle pumps. Point your toes downward as far as they will comfortably go, then flex them back up toward your face as far as they will go. 30 repetitions. This takes approximately 45 seconds. It restarts lymph flow after 8 hours of nighttime stillness and prevents the sudden rush of fluid downward that happens the moment you stand up after lying flat all night. During the day, every hour that you are sitting, perform 20 calf pumps. Keep your heels on the floor and pump your toes upward and back down. Or if you are able to stand, rise up onto the balls of your feet and lower back down, 20 repetitions. This takes roughly 30 seconds. It keeps the lymph conveyor belt moving throughout the day so that fluid does not have an opportunity to accumulate while you are sitting. Set a repeating alarm on your phone if you need the reminder. The consistency is what matters, not the intensity. Before dinner, take a 5-minute slow walk, not a workout, not exercise in any formal sense, simply movement. Around the block, through the house, around the garden. Walking activates the deep calf muscles in a way that seated ankle pumps alone cannot replicate. Do this before you eat, not after and not later in the evening. Now the critical piece. 90 minutes before you go to bed, lie down on the floor or on your bed and place your legs straight up against the wall at approximately a 90-degree angle. Heels above hips, hips above heart. Stay in that position for 15 minutes. While you are in that inverted position, do slow ankle circles, 10 rotations in each direction, then alternating ankle flexes, 20 repetitions. Then, while still inverted, place both hands flat on your lower abdomen and begin breathing deeply through your nose. Let your belly rise with each inhale. Breathe this way for 3 full minutes. This deep diaphragmatic breathing is not simply a relaxation technique. It activates the thoracic duct, the primary drainage vessel of your entire lymphatic system, which runs directly alongside your diaphragm. Every slow, deep breath you take is mechanically pumping your lymph upward through that duct. You are, quite literally, using your breathing as a substitute pump for a system that has no pump of its own. After the 15 minutes are complete, slowly roll to your side, sit up gently, and do something that is not glamorous but is highly effective. Starting at your ankle, use the flat surface of your fingers to stroke the skin upward toward your knee. Move slowly and deliberately. Always stroke toward the heart, never downward. 10 slow strokes on each leg. This is a simplified version of what practitioners call manual lymphatic drainage, and it physically moves accumulated fluid from the tissue spaces into the lymph capillaries, where it can be transported upward and returned to the bloodstream. Within minutes of completing this sequence, you will feel the need to urinate. You will typically release 300 to 400 milliliters of pale, dilute urine. That is the accumulated fluid that would otherwise have woken you at 2 in the morning, forcing you out of a sound sleep and leaving you exhausted the following day. You have just drained it while you are awake, alert, and in control. Dorothy followed this protocol for 3 weeks. By the end of the first week, the sock marks on her calves were gone by morning. By the end of the second week, she was no longer waking up in the night to use the bathroom. By the end of the third week, her ankles at 9 in the evening were the size they used to be at 9 in the morning. Her echocardiogram had not changed. Her medications had not changed. Her kidneys were exactly the same. What changed was that her lymphatic system was finally being given the signals and the mechanical support it needed to do its job during waking hours, instead of being left to struggle all night while she was trying to sleep. Here is exactly what to do starting tonight. 1. Do the PIT test right now before you do anything else. Know what grade you are at. Write it down with tonight's date. You will retest in 2 weeks. 2. Tomorrow morning, identify one source of hidden sodium in your regular diet. The most common culprits are aged cheese, processed or cured meat, and canned soup. Choose the one you eat most frequently and eliminate it for 2 weeks. 3. Before dinner tonight, not after, take a 5-minute walk. Around the house counts. Around the block counts. The timing matters more than the distance. 4. 90 minutes before you go to bed tonight, get your legs up against the wall for 15 minutes. Do your ankle circles. Do your ankle flexes. Breathe deeply from the belly for 3 of those minutes. When you come down, do 10 upward strokes on each calf. 5. Tomorrow morning, before your feet touch the floor, do 30 ankle pumps. Do this consistently for 2 weeks. Then retest the PIT test. The difference will not be subtle. I want to leave you with this. Your ankles are not betraying you. They are not a sign that your body is failing. They are a drainage system that stopped receiving the signals and the mechanical input it needs to function properly. The system is still there. The capacity is still there. It simply needs 5 minutes of intentional support each day to do what it was designed to do. Give it those 5 minutes. The first morning you wake up, press your thumb into your calf and find that the indentation fills back in almost immediately. You will understand exactly what I mean. Leave your age in the comments below. The age distribution of this audience genuinely determines which topics I focus on next. And tell me where you are watching from. Which city? Which country? I want to understand how far this conversation is reaching and who needs this information most. And if someone you love spends their evenings with swollen ankles, send this to them today. They have almost certainly been told it is their heart. They have almost certainly been given a pill that does not address what is actually happening. You may give them the explanation that nobody else bothered to provide.